the Vacom board for my Mac, and that was really the best decision ever. Thank you, sir.
Yeah. So in your 20s, 30s, 40s, 50s, right? Because doctors, they never retire. In your 50s, you won't feel like that, chalo, I attend, I keep on working till 2 o'clock in the night. No. And as you progress in your life, you will start loving your hobbies also much more. So select something. Money is not everything. It is like your life, the quality of life that matters. So that's why regarding this post graduation, don't worry much at this point of time, right? You'll be having enough chance. This question.
Good morning.
Good morning. Yeah. So this is like there were 2, 3 emails about questions. Okay, can we stop? Okay, why don't we stop answering questions in between because it is breaking the link? Yes, it happens. So what we'll do is we'll take the mix of both the things. In case if you have got any question, to just write it down, right? Or you can send a mail, right? Just excuse me for just 1 minute. I'll be back in a minute. Just a minute.
Good morning, sir.
Yes, that correct. All right. Now no problems. Right? So question in between, we do a combination of everything. Every half an hour, right? Or when we'll complete one specific topic, then I'll ask you any questions. So whatever the number of questions are there, we'll solve at that point, and then we'll proceed for the next level. Right? So this is what we'll do from today so that we don't break the continuity. Yes, it is true that it happens. Yeah, thank you. This was very cute. That is it necessary to subscribe to YouTube channel? That is my YouTube channel. Not necessary. Not necessary. It is absolutely up to you. Right? I mean, so can't force it. But yes, regarding this was good. That what about some new content? Because you have not posted anything since 3 years. True. I have not posted new videos since long. But I'm yes, Manasvi. Right now you can ask. Go ahead.
Good morning, sir.
Morning.
I actually missed 2 of the last classes because I had some exams going on. So, like, how should I get back to them?
Very easy, Manasvi. See, what you do is go to this YouTube channel, right? On youtube.com, search for @Dr. Bankim Jani, and then you go to playlist. In that playlist, there is a playlist called General Anatomy. Okay?
Okay.
And in General Anatomy, there is lecture 1, lecture 2, lecture 3, lecture 4. Everything will be in that sequence.
Yes. Okay.
So you can just go through that. What would really happen is the content would remain same.
Okay.
And then you have got that our common link, na, where I'm
Yes.
putting
Yeah,
all
the
this.
span also. Yes.
So you'll get the PDF and you'll be able to understand everything. In
Okay.
case there is any doubt, just let me know. So what I have done is, few of the friends, they must have felt that one email which I answered to Atharva, right? When you asked about the anastomosis, and I answered that yes, I'll explain in class, right? So when I write in class, the reason is just one. It is not so that I don't want to explain it to you. The reason is let everyone hear it.
Yes. Okay.
That's the intention. So
Yes,
for
sir.
any of the query, you can send it by mail. I'll always take it, but it would be in general.
Yes.
And the
I
second
also
second
want-
honest reason, I don't feel like typing much.
Yeah.
Good morning, sir.
Good morning.
Yes. Thank you, sir.
Welcome.
सर 5 पॉइंट तक हो गया है
The points were very simple. Sherlock Holmes book that has been placed, Sherlock Holmes and Agatha Christie fitness lecture is on Saturday. Regarding PG, when people are asking that what line should I select, pehle MBBS karo. And this questions in between regarding that. Now onwards, it would be like once we start a section, once that section is complete, after that I'll ask any questions, then you ask your questions, not in between, so that we don't break the continuity, right? So that is something which will follow. This is regarding subscribing the YouTube channel. Absolutely your wish, right? But yes, we'll be putting some very interesting material. I'm already preparing it, so very soon you'll find it on YouTube also. Okay, this would be extra, right? And sometimes we can conduct some tests even on YouTube also regarding homesickness. This is common. When you will go to nowadays, so you can make a video call, etc. Everything is possible. So you can always talk to your parents, always talk to your friends. But थोड़ी तो homesickness होती है. But you have to evaluate it when you are going for this degree. तो इतना sacrifice तो करना पड़ता है. Dhruvi, you don't have the link? No problem. So after completion of the session, I'll send it across. Basic medicines like cold, cough, fever, antiseptic, etc. To carry. All right, Mansi, I'll send it. I'll put that list in general onto our shared folder, right? So that it is beneficial for everyone. Good point. Let me write. Medicines, common medicine. Medicines, OTC. OTC is over the counter, so that you don't require a prescription.
Sir, sir, how should we study? Like MCQ wise, we should study like point wise or paragraph wise.
Yes, I'm coming to that. So that's the next point. Many of you have asked study plan for the entire MBBS, right? So homesickness we talked about. Regarding the study plan for entire MBBS, don't worry for the entire MBBS, right? Because you have asked the question that how should I study surgery? How should I study medicine? No, the foundation is anatomy, physiology, right? Always learn point-wise in the form of keywords, right? Never cram, never ever cram. Now, in today's session, you'll find that there will be figure on every page. And then there would be some images which will be blank. Blank means they are for your practice. They are for your practice, right? So that's at this point of time, don't do anything. I know you said that, and many of you have even started BDC, BD Chaurasya. Well and good. But those who have not started, don't worry much. Even if whatever we are discussing, even if you are understanding and remembering it, and you can explain these concepts in your own language, you are on the path. That gradually we'll be picking up the speed. A day, and that day is not very far. But when you will see that from the book, we have covered about 70-80 pages in just 1.5 to 2 hours. 70-80 pages of the book, everything in the form of keywords, and still you'll be able to remember everything, right? So this is the thing. Regarding stocks and crypto market, I know because rate of Bitcoin has crossed $122,000. So everyone would be tempted कि अरे मैंने 90 पे ले लिया होता तो. It is all if and but, right? It always happens in the stocks and crypto market. This is like किसी के कहने पे invest किया. As SEBI said, right? As SEBI said that 92% of the investors, they lose their money. The reason? Greed. This is a full-time business. Trust me, it is a full-time business. You have to really dedicate at least 3 to 4 hours every day to understand the complexities and then invest. I do it, but yes, many times till late night. Means you have to track the American market, and it is like a full-time job. So my request to that gentleman, he said that I earned $2,000. Well, good. I'm not telling that you are not brainy enough. But from the matter which you have written, I would say it was a chance, right? Bitcoin increased because of that Trump uncle said such things, right? And that Bitcoin shot. Never happens every time. So focus on something which you are supposed to be excellent in that. That excellence, that attitude, excellence in one subject will automatically flow to other subjects. So after that, even if you feel like, yes, I want to learn photography, so then you'll be going at a professional level in photography very fast, because your brain is now with that attitude that kill the competition, learn to such excellence. So right now, just don't try to ride on two horses. Ek, pehle ek. ठीक है? So I think I have answered this question. Regarding this test, पहली test surprise नहीं होगी. Is next Saturday. Next Saturday means not this, next to next, right? So it will be like end of the month, right? End of the month. I don't know the exact date, but so today is what? Today is, yeah. So roughly around about 24 today. End of the month, can we take a test? Right? This will be a planned test. I'll let you know in advance, and then we'll have the test.
Yes, sir.
Yes, sir.
So we'll see that. Regarding personal batch details, मेरे दोस्त अभी यहाँ पे सब free है. Whenever it is needed, I'll let you know. ठीक है? I'll let you know. Facebook request, don't send. I don't go on Facebook. Well, there is account, but last time when I opened my account, that was somewhere around about 2013 or 14. More than 10 years have passed. I don't even go to my Facebook account, right? So don't even send the request on Facebook. So this I came to know because from your email. हाँ बोलो.
You told us that you'll tell us something about those savings and all for USMLE fees. So when do we start that?
USMLE etc. will not now, but somewhere.
No. The fees for saving.
For
You said if you start saving 300
Achha,
a month,
the financial part. So that will take. We can take even say in fitness, right? Let's take it this way. Right? Physical fitness, mental fitness, and financial fitness. So we'll take it on Saturday. It's a very small thing. Just I need to show you the power of compounding and in which areas one should invest. And the moment you become 18 plus, you are eligible to open accounts. Right? So we'll surely take that point. Good. All right. So let's start with our today's topic. What time is it? 11 minutes past 10. Let's start. So our today's target is we should know all the bones of the body. Right? We should really know about them. Let's start with the most complex thing, and that is the skull. But before that, we'll see that how the entire structure is organized. So here it is. This is what is called as the cranium. Cranium is khopri, right? In which there is brain. Its function is save the brain. Because that's it. Save the brain. So that's why it is tough. These are flat bones, but they are tough. Ansika, your voice is cutting. Your voice is getting interrupted. But yes, all the questions once we complete a section. So here it is. The cranium, which is saving the brain, protecting the brain. Facial bones. Now, these are the bones which are forming the face. Very simple. But then there is a special bone which is called as the mandible. Right? So thus, the moment you take head, the head is comprising of mandible, facial bones, and the cranium. During study, whenever you will be studying the bones, right, the skull is usually cut at this level. Skull is cut at this level. Right? And then we open. So when we'll be studying head and neck, I'll show you when we'll be studying osteology of head and neck. So we'll cut the skull, we'll open it, and then we'll see what is inside and what is over here. Right? So can you imagine that when we cut the skull, there would be lots of visualization. Right? When you cut the skull and then you take that cap off, so then there'll be such small, delicate bones over there because those bones are very delicate structure. That is the brain which is lying. There'll be several holes, number of holes. Kyun? Because via those holes, the nerves are entering into the neck, and from neck, they are getting distributed to the entire body, right? Because brain is there, so the brain will be sending the nerves. So that's what we'll see. Face, these are the facial bones. These facial bones will be coming in more detail. We'll be talking about it in more detail, but these are very delicate, thin bones. The concept is keep the face light. Because if these bones are solid like upper limb and lower limb, so then the face, the weight of the head, that would be too much. And second, because of spaces, that is what is called as the sinuses. Because of the spaces, it keeps the head light. At the same time, it gives resonance to your voice, right? Resonance to the voice. Function of mandible, just to chew chewing gum, right? In short, chewing. It is called as the process of mastication. It is called as mastication. This is chewing. Process of mastication. That is the process of chewing. And very interesting process, right? Because sometimes we chew like this, sometimes we chew like this, right? So how the masseter, both the masseters, they work together, or one contracts, one relaxes, one contract, one relaxes. So that's how the jaw keeps on moving and it keeps on grinding the substance. All right. Then the collarbone, which one can always feel. The horizontal bone. You remember we talked about this clavicle. It is a horizontal bone, the only horizontal bone, right? It is also called as the beauty bone. And in last batch, someone said. And why beauty bone? Because they say that in models, right, especially these Korean serials, the pura collarbone dikhta hai. Well, okay, right? So in this note only, I must have written somewhere over there, the beauty bone. Okay. Good to remember. Okay. This collarbone is connected with one of the very powerful bone, very important, and that is scapula. Scapula, which is lying on the back. But the entire structure is such that those scapula is on the back. There is a glenoid cavity, which is on both the sides. Right? There is glenoid cavity, which is on both the sides. This is the glenoid cavity. This is the glenoid cavity. Right? So it is this glenoid cavity where the femur gets attached. So femur gets attached to this scapula. And this
Sir,
scapula,
humerus.
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 keep yourself mute, please. So this scapula is also connected to over here with the clavicle. So see the thing. When we say our upper limb is connected with the body, thorax, nowhere it is connected. Thorax is made up of ribs, right? It is made up of ribs. Here are the ribs. So that's what we call the thorax, right? This is the rib. These are the ribs, right? Thorax. Upper limb or our hands, they are not connected to thorax. On the back side, scapula. Scapula is connected to clavicle. And then with scapula, there is the femur. So here it is. They form the combination. Right? They form the combination. So that's the reason this glenoid cavity is shallow. That gives mobility. There are two concepts. One, mobility, and second is stability. When we'll see the lower limb, we'll see that in case of innominate bone or the hip bone, this cavity is so deep. So when the head would go, head of femur would go, it would almost cover it fully. So over here, mobility is not important. Stability is important. Right? Because when you are standing on your feet, the stability is important as you want to stay straight. While over here, the mobility is important because it is shallow. So head can really actually move. So that's why the head which is moving, just all of you, put your hand exactly over here on your shoulder. First, move it forward, backward, then take it slightly at an angle 90 degree and then take it all the way up. And see what do you feel. You will feel sometimes muscles, sometimes some bone is coming in between. Yes, that's true. So that's why in case of upper limb, the muscles will be working like some of the muscles, they will be working only till 90 degree. But if you want to raise above 90 degree, so then there is a different set of muscles. Why so? Because the way they are attached. Some of the muscles that they will be working till 90 degree, rest of the muscles they are arranged. So that is where the 90 degree muscles, they will give the relay to these top muscles and they will take the hand all the way up. This is important from clinical aspect, right? When we'll be discussing upper limb, I'll keep on showing you the tests, because just from his movement, right, you'll be able to say that which nerve is getting damaged, because every muscle is supplied by different nerves. So it is like an electronic circuit. So if you know that this particular muscle, which is keeping the scapula near, and then as this person is trying to push the wall, right, that scapula is getting prominent, 100%, it is the problem of serratus, long thoracic nerve, right? Beyond doubt. And these are called as the spot diagnosis. They are called the spot diagnosis. Spot diagnosis. Spot diagnosis means no questions are to be asked. You just see and then you say, okay, it is this. There are more than 100 such things where you see and you diagnose, right? So gradually we'll discuss everything. And during our discussion of anatomy and physiology, I'll teach you all these 100 spot diagnoses. So imagine by the time you complete your say anatomy physiology, you will be finding that many of the conditions mein to puchna bhi nahi padta. You are talking to the patient on phone, right? And then as he is describing, you just ask specific question and you'll be able to diagnose. Right? So these are the things. That's why I say medical is so beautiful. So done. Scapula, clavicle, humerus, mandible, facial, cranium, and the entire spine, right? So these are the cervical vertebra, which are on the neck. One simple rule all the way from cervical vertebrae, they are very beautiful, thin, delicate, amazing. And as you go down, those lumbar vertebrae, right, they are like gundas, right? Big, thick, right? Muscular, very powerful. Reason? Weight transmission. Cervical vertebra, they have to handle only the head. Now they are delicate because you want to move your head very freely, right? If they are thick, so then the movement would be very slow and restricted. You want a mobility, so that's why those vertebrae, they are very delicate, right? We'll go into more detail. Regarding the, as you go down, all those thoracic vertebra, they will be telling that our function is attachment of those ribs, right? Attachment of those ribs. So when the ribs are attached, so their function is to keep the thorax steady. There is movement which is only for the respiratory system, and the chest has to expand and collapse. Right? We'll work on that. So here it is, just for the revision, right? You can just go through that. Can you identify clavicle, scapula, glenoid cavity, then the head of the femur, head of the humerus, all those vertebrae, ribs, cranium, facial bones, mandible, and the cervical vertebra. Very easy, right? No worries. On to next. Let's go into slightly more detail. Now, this is head and that's the chest. So over here, this is the area where the things from the head and neck, they are entering into thorax. Right? There are certain things which are entering into thorax, either entering or coming out. Makes sense, no? One of the simple thing, the heart is here, from heart, the aorta, from aorta, both the sides, right? Carotid arteries, those carotid arteries are here and they have to go all the way to the brain, right? External carotid to the face and internal carotid that is going into the brain, vertebral artery combining and then going into the brain. Finally, so everyone is coming from the heart. Heart is in the thorax. So it is this neck, right? And they are going through neck. So that is this portion, right? It is this portion. That is what is shown in the figure. So this is the portion where it is called as the thoracic inlet. From here, structures will be going in and out, right? From the in and out. So how this and such things you will be asked about, that what are the boundaries? In anatomy, they will be asking you this question they'll be asking you this question, that what are the boundaries? Right? What are the boundaries? So here, as if you are watching from the top, right? So we are watching from here. Make a wild guess, right? Even if you don't see the image. Clavicle is in front, so anteriorly clavicle, right? See, nose is here. That's the nose, right? So clavicle would be anterior. We'll write anterior like this, A-N-T and then R. So this is anterior. Theek? Scapula is a backbone. So this blade of scapula, this one. This one. So this is the clavicle, one boundary clavicle, right? That's the scapula. So scapula is situated, it is on the back side. You know? Scapula is posterior. All right. And this is the first rib. How good, right? That's the first rib. See this? You know? So that's the first rib. So if I want to say this first rib is, and so this would be like a triangle, no? This would be like a triangle. Triangle of thoracic inlet. We are going into the thorax, right? Via this triangle. No doubt. This is well supported, well created by so many muscles, but this is a gross thing. Only the bony structures we are talking about. So in this case, if I want to describe, listen carefully. Clavicle is forming the anterior wall of this triangle. Scapula is forming the posterior wall. So then first rib is forming which wall? First rib is forming which wall? What name would you give?
Medial wall.
Repeat.
Medial wall.
Shabash. Very good, dost. It is the medial wall. Correct? Wonderful. Happy. Bahut acha. Medial wall. Is this clear to everyone? Anyone any doubt on this?
Can you repeat?
Right? Bada easy hai na? Medial wall because it is on the medial side. Great.
Sir, can you repeat?
Why not? See, that was scapula. Again, that was the clavicle. And over here, this was the first rib. The entire body is here. Now clear? Clavicle would be anterior because it is the anterior bone. Yera, anterior bone. Scapula is posterior. So scapula is posterior. Hai na? And this rib, see this rib. So this rib is medial. So that's why first rib is medial. So these are the walls which are formed. Medial wall, anterior wall, and the posterior wall. This would be the pattern. This will be the pattern for studying almost all the triangles and all the structures. So every time whenever we'll be talking about, say, these walls, so there'll be anterior wall, posterior wall, medial wall. Now, in this case, so there is no lateral wall. But what if there is a structure which is like this? So in that case, there will be anterior wall, posterior wall, medial wall, lateral wall, right? It will happen if we are talking about this side. We are talking about this side. So there can be medial and lateral wall, especially if the structure is square or quadrangular. Correct? Okay. So this is good. So now we can, so this was our view. As if you are watching from the top, right? So over here, when we'll start putting the organs. So we'll find this is the area where the lungs would be there, right? Inside the thoracic cavity, lungs are coming almost to this level, right? Their lungs are preparing. And this thing is called as the apex of the lung. Apex, the top. Those who are smokers commonly are affected this area, right? Because air travels up, the dangerous air. Here it is. Rest all the structures, they have been removed and only these three structures are kept for the clarity. So here it is the scapula, which is the posterior structure, clavicle, which is the anterior structure, and this rib number 1, right? That is forming the medial side. Over here, there would be sternum. In fact, it would be manubrium, right? It would be manubrium. this shield like this one. We are talking about this one, right? So that is manubrium. Taking you to one, so manubrium. Taking you to slightly another component of it. That's the scapula as you are watching it from the top. Now, can you see there is something which is going like this, right? So this is like an extension from the scapula. Scapula is there, but something is coming out, right? So this is called as the acromion process, right? It is called as the acromion process. It is getting extended, and it is the acromion process which is actually making a joint with the clavicle. Am I clear? Scapula is there, right? In scapula, watch this, over here, this, right? So the scapula is like this. Scapula is like this, right? We are talking about this. So scapula is like a triangle, right? It's like a triangle. On this triangle over here, it is the humerus which is connected, right? Here, this one is humerus. And then there is one extra process which is over here, and that is connected with the clavicle. So that is the clavicle. So this process is called as the acromion process. This one. And this is clavicle, which is getting attached. So we need to give a name because it is a joint. Right? So that's why we'll be naming it as acromioclavicular joint. Simple, right? Let me do one thing. Okay, I've turned the chat on. So for any of the query, if it is a very important query, just send it. I'll cover it during our session only. So that is what is called as the acromioclavicular joint. Easy. So now we know about rib number 1, clavicle, acromioclavicular joint, scapula. So that is acromioclavicular joint. Let's move further. So this is acromioclavicular joint. That is good. Clavicle, we know about it. This glenoid cavity, that red part, that is glenoid cavity. This glenoid cavity is shallow. Why it is shallow? Because we are interested in mobility. So if it is shallow, so then head can easily move, right? So that is what is called as the glenoid cavity. And glenoid cavity is connected with what? It is connected with humerus, right? Then this is, as we move further, we'll find that this clavicle is connected to manubrium. So this is also a joint and it is a mobile joint. Yes, it can move. So if you see, it is moving, right? So there are so many areas where the movements they can occur. So this is the joint which is between clavicle and the manubrium. And then this is the manubrium, this is the body of the sternum, and the lowest portion, it is called as the xiphoid process. Xiphoid process. So we know scapula, we know glenoid cavity because humerus is connecting over here. We know this butyrybone, collarbone, or the clavicle. We know the acromion process because it is connected to clavicle. And we know the xiphoid process. We have not talked about this, that is coracoid process. Crow-like, kauve ki chonch, crow-like. There is one more. Can you just appreciate this part? This part. There is one protrusion, right? It is like kauve ki chonch. That's why it is called as the coracoid process. Kora means kauve. Right? This is like in Greek language, this is like beak of the crow. The appearance is similar to beak of the crow, and this is the coracoid process. Importance of coracoid process, so many muscles would be attached, right? Why is it called process if it is not a... Well, process means it is like an extension, right? It is like an extension of the bone. So all good, right? So if we are asked about the scapula, so in scapula there is acromion process and there is a coracoid process. These two things. This is for the practice. So you should be able to identify that what is 1, what is 2, what is 3, what is 4, what is 5, right? Then what is 6, what is 7, then what is 8, and what is 9, right? And what is the name of this joint? 10. Correct? Anything you want to ask till this point?
Sir, while marking, please change the color. We can't see properly.
Which one?
While marking the positions, can you change the color? We can't see it properly because I'm seeing the lecture on mobile, sir.
Right? So this PDF you will be getting, and just try to identify these structures. Once you learn from here, and then you have to just, this is for the test. Acha, coracoid process is nothing but it is the extra extension. Here it is, right? See, this is the coracoid process. This one, right? That is coracoid.
So,
Huh?
coracoid process is an extension of the scapula.
Scapula only, yes, yes.
Okay.
Now we talk about the ribs. In ribs, there is one very interesting thing. There are some true ribs. There are some false ribs. False means not knuckly, right? They are original ribs only, but their function is different. So we have got 12 pairs. 12 pairs of ribs. So total 24. Now this is how the ribs they go. The ribs, they start from the spine, from the vertebra, all the way go, and then they attach to the manubrium sterni over here. You can watch that. See, they are getting attached. They are getting attached to the sternum. They are getting attached to sternum. Sternum. Correct? So these are the ribs number 1 to 7, and they are called as the direct. They are directly connected, and that's why they are called as the true ribs. True ribs. True ribs. Rib number 8, 9, and 10. See what happens. Rib number 8, 9, and 10, they don't go all the way till the manubrium. They end on rib number 7. Right? Rib number 9 will end on rib number 8. 10 will end up on 9. So the whole cage, right, which is formed. But when you see the edges to the edges, these edges, they are like this, right? They are like this. It is because of the rib number 8, 9, and 10, and these are the ribs which are indirectly connected. They are not directly connected to manubrium sterni. They are connected to other ribs. They are connected to rib number 7. And that's why they are called as the false ribs. False ribs. Clear? And what about last 11 and 12? See, those last 11, 12, their anterior ends are floating. Right? They are not connected. They are connected to only the posterior part. And that's why 11 and 12, they are called as the floating ribs. It is easy as that. So if we summarize, right, so then the summarization would be something like this. 1 to 8, right? In fact, 1 to 7, 8 to 10, and 11 and 12. 1 to 7 are true. 8 to 10, they are false. And 11 and 12, they are floating. Which muscles are attached, how they function, sab baat mein. Right now we are just understanding the structure. Yes, Hansika, want to ask anything?
Sir, I wanted to ask what connects clavicle to the manubrium?
Joint. Joint. It is the joint, no? You are talking about this.
Yes, sir.
It is a joint. When bone to bone are there, so we'll study it in joint that when there is one bone. Say, for example, over here. So when it is the glenoid cavity, when it is connected to head of the humerus, so then they are forming the joint. Right? Here also, it is a joint formation. Here also, there is a joint formation. So there are various types of joints which we'll be studying as we proceed further. Right? But right now, what I'm trying to emphasize is, yes, it is connected over there. So just keep it in mind.
Yes, sir. Thank you.
So that is done. Now over here, once again, if the coracoid process, you have got any doubt, so let's remove all of them markings. What is this? Acromioclavicular joint, no doubt, because this process is what? This is acromion process. Acromion process. This is the extra protrusion. So that is the coracoid process, right? This is the cavity. It is the glenoid cavity. Glenoid cavity. And this is head. This is head. Done. So you know now these many structures without any problem. By the way, what is this? Which structure is this?
First
First
rib.
rib. First
rib.
First rib.
rib number first.
Rib number first. #1. Achha. Now let's watch from the posterior side. Right? As I said, posterior side, so that means now we are in the back, our patient is in front of us, so we are watching the posterior side of our patient. Back side. Coracoid process importance, muscle attachment. That would be a wonderful topic. When it is, you'll find that the size of coracoid process is this much, and then the muscle attachment, it is a group of muscle which are attached. What's the advantage? Why bichara itna chota sa coracoid aur uspe itna zulm? No. When the coracoid moves, it will pull all the muscles together. So it is not so that God is a very good biologist. He is a very good mechanical engineer, because he knows that if pull is to be made, one surface on which everyone is connected, you pull once, all the muscles, they will be pulled. So that's why this will be a special topic. Right? Here it is. Now we just focus on the clavicle. On the clavicle, we have heard of the spine of scapula. Suna? We talked about it.
Yes,
You can
sir.
feel it.
Yes, sir.
Right? You can feel it. So that is the spine of scapula. Now see it. Right? Watch it on this side. The only prominent thing, right? It is impossible. Koi kitna bhi mota ho, right? Whatever the amount of fat it is. But when you do it, you'll surely feel this bony prominence, right? A horizontal bony prominence. That is spine of scapula, or also called as the spinous process. Process means extension. So spinous process. This is a triangular structure. And in between there is spine. So anything which is above the spine will be call it supraspinous. Anything which is below will be calling it infraspinous, right? And when the muscles name are there, so we'll just simply say supraspinatus and infraspinatus muscles. Done. Right? So muscle name will also come. This is like we are preparing a structure. Then we'll start adding some muscles. Then in between those muscles, we'll put arteries. Right? Veins name. First arteries. Because in almost 95% of the cases, arteries and veins, they are same. Then we'll see wherever the differences are. So that way, picture would be clear much earlier. And then we'll start adding the nerves. Okay, here it is. By the way, in this, see how good. This is 11th and this is 12th, right? Those images, these images, they can easily show 11th and the 12th ribs on both the sides. This is a triangle. This is a triangle. This is a spinous process, right? And then this particular, because it is triangle, so this lowest angle is called as the inferior angle of scapula. I mean, कौन सी बड़ी बात हो गई, right? Inferior angle of scapula. आलू को आलू ही कहेंगे, right? This is a triangle, and this is the triangle. This is the lowest angle. So then what's the big deal? But this point is very important. This inferior angle of scapula, this level, right? That is of tremendous importance. Many of the cases, because these are the bones which you can feel. So from that, if you make a judgment, it is from this distance, the stomach would be there. It is from this distance, there would be the gallbladder. So that way you can make a perfect judgment that where exactly the structure is lying. Important criteria for blank space anatomy. Bony prominences, they are important for which type of anatomy? Bony prominences, they are important. Surface anatomy. Who said that?
Should
Shabash, shabash. Very good. Surface anatomy. Right? Because from surface, you figure out that this must be the organ which is inside. But for surface, you can't say it's a whole body. No. You calculate. When you say, okay, this is the area of precordium. Precordium means the area which is just above the heart. So then you have to actually calculate the ribs. And from that, you'll figure out that, okay, this is the portion where underneath the heart would be there. Right? So same way, this is the inferior angle of scapula. Patient ko ulta sula ke, you just feel the spine and you go down, you'll immediately be able to pick up inferior angle of scapula. Right? Done. Here it is. Which nahi hai isme, this is. That obviously, this is what? Humerus. And with respect to the body, humerus is lying laterally. This is the combination. These are graphic images, right? Computer generated images, this one. When you take X-ray, it will look like this. So, abhi to baat hui that these ribs, they are connected all the way to the manubrium. But यहाँ पे तो बिल्कुल टुकड़े दिखाई है, right? Here तो there is so much of break. There is so much of break. The answer lies over here. Here. Ribs are not only connected, right? Ribs are connected on the backside with the vertebra. As they go forward, right? When they are near, this is nothing but this is cartilage. It is cartilage. They get connected to cartilage, and then that cartilage would be landing on sternum. That cartilage will be landing on sternum. Right? So original rib, so it will stop midway, and then the cartilages would come. These joints, they are vital because this gives better mobility to the chest. Right? So that's why the cartilages, they are over here. This is the real dissection. Right? So where everything is removed, but these are the tissues which you can see. Here it is from another angle. Right? This is rib 1, this is rib 2, this is rib 3, 4, 5. Right? The cartilage. This brownish thing is cartilage, and this white is bone. This is acromion process. This is coracoid process. This is glenoid process. Now watch this. What do you see in this?
Clavicle.
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 But why this clavicle is like this?
Fracture of clavicle.
S shape.
Yes,
Fracture
exactly.
of clavicle.
Right? This is fracture. Clavicle. Absolutely. This is a fracture. There are various types of fractures. Simple, hairline, commuted, all those fractures, etc. we'll discuss. But yes, right now you need to
Compound fracture.
Now see this. This is what?
Fracture of
Fracture.
clavicle.
And a fracture.
Fracture.
Okay, you have started answering what is one, what is two. This we talked that, right? Coracoid process, it performs specific function. Yes, attachment of muscles. Spine of scapula, just take your hand and take it on the backside. Feel it. Once you feel, you'll remember it. Kunjan?
Sir, in this picture, is it fracture on the acromioclavicular joint?
Hmm.
Okay.
So you're talking about this acromioclavicular joint?
Yes, sir.
Acha. This is
But
the
it seems a bit shifted.
this is the acromion process. The clavicle is this. Right? There is overlapping of shadows, and then from here it has been broken. Right? All these differential shadows, say for example, this is soft tissue shadow. All those things we'll discuss in radiology. But right now, yes, the idea itself, okay, this is near acromioclavicular joint. Perfect. It is.
Sir,
Hmm.
I'm not able to understand, like, I'm not able to identify the locations, like which is the head of humerus and all that in the previous diagram which you showed.
Which is what? Which is what?
I mean, the identification of various bones, it's kind of like difficult for me to locate. Like it's overlapping. Everything is overlapping.
It will be in the body. It will always be like this. But here we have tried to simplify it as much as possible. See, we have just discussed 2-3 bones.
Yes, sir. Here I'm able to understand. Even when you showed that this photo,
So
I
in
was able to
X-ray, you are
understand.
talking X-ray?
Yes. Yes, sir.
Don't worry about the X-ray part. This is just to show, right? Then I'll show you a systematic method about how to identify things in X-ray. First thing, this is a pathology. Pathology means there is something wrong, right? No, I'll never be showing you pathology directly. First, I'll show you normal X-ray, and then we'll make a change in that. That is in the form of fracture. Yahan pe to it is just for the reference. Means single shot. Even if you say this is fracture of clavicle, was more than enough. I'm not telling you that, okay, identify first rib because this is the first rib which is overlapping. This is the second rib, then the third rib, overlapping shadows, all those things will occur. Right? Abhi kuch nahi, nothing to worry. Can you just identify this fracture? Bas, bahut happy.
Yes, sir.
Similarly over here, yes, it is a fracture. On to the vertebra. So we have got 7 cervical vertebra, right? Cervical, thoracic 12 because 12 ribs, lumbar 5, sacrum 5, coccyx 4. Right? So thus total is 33. But in reality, it is not like this. Sacrum is a single piece. It is because all of them, they are fused. So you'll find that the whole thing is fused together. So all these 5, they have become one. Similarly, coccyx, it is like a tailbone. Instead of 4, it has fused and there is one only. So total would come to 26. Right? 12 and 5, 17, 7, 24, 25 and 26. So total 26. So this is theory. This is practical. Practically speaking, there are 26. Theoretically speaking, there are 33 vertebrae. The question you asked is sacrum. Last time we said that there is axial and appendicular system. Right? Appendicular system. Axial is something which is in center, appendicular heart palm. So this is appendicular, and all the way from here onwards is appendicular, and in between what it is, that is the axial. Right? So vertebra, entire vertebra, all these ribs, right? And the sacrum, coccyx, they are forming the central axis. From hip bone to all the way up to toe, and from scapula all the way up to the tip, they are appendicular structures, right? Appendicular limbs. So appendicular means limbs. Let's dive slightly deep into humerus because it is very interesting. So that's the head of the humerus. I'll first draw it. This is the head of the humerus. This humerus head, which has got tremendous capability of the movement. So that is head of the humerus. Then there is some prominence. Right? That is called as the tuberosity. This one. This is the word. Tuberosity. It is nothing but prominence. Prominent. This is tuberosity. And this is prominent. So there are two prominences. One here, and another here. This is bigger. So that's why we call it greater tuberosity. And second one, which is here, it is smaller one, so we call it lesser tuberosity. Right? In between two tuberosity, because there is one flat, there is one bone, and on that there is one mountain, there is second mountain. So there would be valley in between, and that valley is called as the bicipital groove. That is called as the bicipital groove. And its other name, intertubercular sulcus. Two tuberosities are there. So in between, there is a space, and that is intertubular sulcus. Sulcus means shallow ridge, right? So this is a ridge which is between two tuberosity. So that is called as the intertubercular sulcus. And in this, the biceps will find the tendon of biceps will be traveling. That's why it is also called as the bicipital groove. Right? Is this part clear?
Yes, sir.
So can you repeat this part?
So we can even draw it like this easily. This is greater tubercle, right? Greater tuberosity. Greater tuberosity. There is lesser tuberosity. So in between space, right? It is a shallow space, so we'll call it sulcus. This sulcus is between two tuberosities, so we'll say intertubercular sulcus. And in this intertubercular sulcus, what is passing? Biceps. For biceps, so it is a muscular thing. So then there is what would pass is the tendon of biceps. So which tendon? One is long, one is short. Long tendon. And that's why this groove is also called as the bicipital groove. It is also called as the bicipital groove. So that is where things are going. When we'll be talking about biceps, Yeah, again, we'll be talking about it. So here, yes, we talked about this. Greater tuberosity, lesser tuberosity, bicipital groove. It is also called as the intertubercular sulcus. All good. On the lower side, now this is about, we talked about the upper part of a humerus, upper part. Now let's come down. On lateral side, these are all prominences, right? Even if you touch, even if you touch, you'll be able to feel. Yes, right? From the bicep, from upper limb, right? We just try to feel. Above the elbow. Above the elbow, you'll be able to feel both of them. These are the bony prominence. They are called as medial epicondyle and the lateral epicondyle. Right? True. Now the hand, it moves so easily, right? It moves so easily thanks to this big surface area. Such a big surface area. Big one. That is what is called as the trochlea. Trochlea. Right? Trochlea means pulley-like. Pulley-like. This is, see, this is more or less like pulley. Right? So in center, it will move. This is the central area. The ring-like structure. So that is the central area through which it will move. What we are doing, we are talking about elbow joint. So, okay, from the top side, we have got the humerus which is coming and the part which will be articulating, because this is, see, it is so fresh. It is bright, shiny because of the presence of cartilage. So this cartilage will be between two bones so that those bones, they don't rub against each other. When this cartilage is gone, then bones start rubbing with each other, gives pain. Okay? So this is our humerus. So then just next to it, two bones. You know the name of the bones, radius and ulna. You know those names, right? Radius is on outer side or inner side?
Outer.
Outer side.
Outer
Outer side.
lateral
Yes,
radius,
exactly. So
medial ulna.
radius is situated laterally and ulna is situated medially.
Medially.
Right, good one.
Thumb side.
Thumb side. So here it is. This is our humerus. Right? In lower limb also it would be like this. In lower limb, this would be over here, it would be femur, and over here tibia, fibula, same pattern. One bone will be bigger, one bone will be smaller. Over here, we have got the humerus, radius, ulna. One bone is bigger, one is smaller. That's how they are connected. Now we talk about one more new concept, and it is called as the bursa. Bursa. Bursa is nothing but it is so this is a bag, right? And it is filled with fluid. This is normal, right? It is filled with fluid, and the function of this is that it gives cushion in between so that bones, they don't rub against each other. This avoids friction. So where do we expect this? So here there is a trochlear process, right? This one. Similarly, there will be specific areas. That's the ulna, radius, right? So there are specific areas which are called as the olecranon process, etc. But right now, just see that they come in contact with radius ulna and the red shiny part, that is the trochlea, with that formation. So this is how elbow joint is formed. These two bones, radius and ulna, they are connected with each other by interosseous membrane. Interosseous. Interosseous means
Between bones.
between two bones. Osseous. Osseous means related to bone.
Bones.
Bones.
Is bones. Inter means two. So in between bones, this is the membrane. So this is the membrane which is two bones, because we cannot keep things empty. So that membrane would come. That membrane will keep both the bones together. So it gives the stability. On to the wrist. Here is the radius where we take the pulse. This is the site where we take the pulse. And the ulna, which is on the opposite side. Okay. See this. Try to touch here. You'll feel a bony prominence. Try to touch. You'll be able to see also a bony prominence. Similarly, on the opposite side, you'll be able to see the bony prominence. You'll be able to free. That is called as the styloid process of radius, styloid process of ulna. Styloid process, right? Very stylish, right? So that is the styloid process. Now comes so we have one bone 1, bone 2, 3, 4. Then there is 5, 6, 7, right? And then there is 8 bone, but they are overlapping. We have another image. Here it is. Here it is there. So, chalo. I'm just removing these numbers. So, area clear. Right. So they are arranged. Right? They are arranged in 2 rows. And here it is. See how they are connected. Right? How they are connected. They are connected with such small bone-to-bone attachments. They are all small ligaments. Now collectively they are called as carpals. That's why they are called as intercarpal ligaments. Ligament is is between 2 carpals. 2 carpals. They are intercarpal ligaments. So coming to this, if we have got individual or not. Achha. Right now, just see this, because with only this figure, it would be a bit difficult to understand all the bones. Right? And right now, our target is not to remember all the bones, just we should be having a clear idea about what it is. These will be the names of the bones: scaphoid, trapezium, trapezoid. And on this side, we have got another bone: lunate, triquetrum, pisiform, hamate, len, right? And the capitate.
Sir, they describe the shape. Is that why they are named like that?
Yes, they are from their shape. That's right. So scaphoid is like boat-like. I'll show you all those bones individually. But yes, it is from shape. But this is like that scaphoid. So this is looks too pretty, right? Then trapezium, trapezoid, capitate, hamate. It is in this order things are arranged, right? But right now, just try to remember the bones, name of the bones. Don't go into this detail. Some things they are very prominent. Say, for example, this is hamate, right? Hook of hamate. So this is like a hathoda, right? Then capitate, a big bone, right? Trapezium, trapezoid, they are small. See, this is a boat-shaped bone. Boat-shaped, right? This is a very small bone. It is pisiform. Then this is like a half moon. So that is lunate. The base is triquetrum. So we have got scaphoid. We have got scaphoid. Next is lunate. Triquetrum. And the PC form. PC form. So this is how they are arranged. And then trapezium, trapezoid, capitate, and hamlet. So that's how all those 8 are attached. Next is over here. So these are metacarpals. Metacarpals. So we have got 1, this 2, this 3, this 4, this 5. No confusion. Baki ka jo hai, these are all phalanges. Right. So in the email which you asked is the confusion. This is thumb. So thumb has got 3 phalanges. No. This one is metacarpal. And then these are the phalanges.
Sir, from which position we are looking at this image? At this net-like structure?
Palmar aspect. Look at, this is where we take the pulse. So palmar aspect. We are looking at the palmar aspect.
And upside image?
This one?
Upside, which you show first.
This one? This is also from palmar side. Same. Watch this. Over here, we have not put the ligaments in between.
Okay.
We have removed the ligaments over here. And on that, there will be muscles and then finally the skin. So that is how the hand would finally look like. Okay. So this is about the upper limb. Right? Acha. For today, we need to stop at this point. Right? We'll meet on Saturday, and in next session, we'll be completing this rest entire part. Right? So any queries in this, or you can just, tuberosity means prominence. Is it a bone or a process? No. Bone is a general thing. Bone is, say for example, scapula is a bone. Right? Scapula is a bone. And all this spine of scapula, the spine of scapula is what? It is part of that bone, right? But for the identification, we have given the name. So that is the spine. Okay? So the question is it a bone or a process or no? All of them, they are bones only. But when we say process, that means it is extension of that bone. When we tuberosity, it is round thing, but slightly prominent. Right? So that is the greater tuberosity.
Sir, what is the difference between extension and protrusion?
See, tongue is protruded. Tongue is forwarded. Right? If this is the position of the tongue, then this is what is called as the protrusion. This is the tongue, that is protrusion.
So
right?
poking out.
And the extension is when the joint is involved and it is bent or extend. This is flex and this is extend. So when movements are from the joint.
Okay.
All right. So as such, I'll put this file into our shared folder. And next time, so we are discussing fitness. So Tuesday, we'll continue from here. Right? We'll finish this. And I'm talking about next Tuesday. And then on Thursday, we'll have one more topic. And then the Saturday would come. That would be the day of the exam. Right?
Hello, sir. Can we call it lateral greater tuberosity?
You can.
Okay.
It is, but from their size, it is said the greater and the lesser because their size is big and second size is small.
Okay. Thank you.
Sure, you can say. All right, I have saved it. Right, I'll put it.
Can you explain this?
Which one?
This slide.
So these are the carpals, right? And in between carpals, bone to bone, so they are called as intercarpal ligament. And then that's the palm. That's the palm. So palm is formed by metacarpals, palm. And then these are the fingers. So here, see the phalanges, right? 3 phalanges are there. And in thumb, there are 2 phalanges.
Okay, thank you.
All right. So, save.
Sir,
me,
where
sir.
can I get the PDF?
Sir,
That PDF I'll be putting into our shared folder, right? You'll get this. And in case if you don't have that shared folder link with you, then send me the email at this, on this. Right? I'll send you the link. Because by now, mostly everyone has got that link. But still, in case if it is not with you, just let me know and I'll send it up.
Okay, sir.
And I'll answer
Sir.
all these questions, right? What you have asked in email, I'll answer by the end of the day.
Sir, can you please go over the elbow joint again? The leverage part.
This one?
Yes, sir.
So this is the area, surface area on this one. That is the complete surface area of the humerus. So during the entire movement, right, it is just gliding. This is gliding on what's called as the trochlea.
Sir,
So the
but there
entire
is a synovial
surface is
cavity over there.
trochlea.
Yes, this is
Okay.
this is trochlea. Right? The pulley-like round thing. This prominence, this big rounds, right? Wait, these big rounds, they are called as capitulum, and then this one is called as the trochlea. As such, just I'm even if you confuse with the names, not to worry, not to worry. Just to know this much is sufficient that yes, it is got the big surface area on which the movements will occur. But that is sufficient.
Sir, but synovial
sir.
cavity is present between bone to bone, no?
Yes, again.
Synovial cavity is present between bone to bone, and in elbow there is a synovial cavity, right?
Which cavity?
Synovial, fluid-like.
Synovial is a joint. Synovial joint. Synovial membrane, synovial fluid. So that is when the joint is formed. See, this is one bone. This is another bone. This is third bone. And then it is packed. In between, there is synovial fluid. This is called as synovial capsule. And in between, so this is what is forming. Otherwise, the bone is here, this is here, this is here. But this area, that is called as the synovial joint. That is when the entire joint is covered with a membrane, and in that there is fluid. Because it would not happen in all the joints. It would not happen. It happens only in the weight-bearing, long, big joints. Right? In some of the cases, it would be flat. Just bones are moving like this. Right? So that's what I said, that when we'll be, today we are discussing the bones. They are different type of joints. Right? Got it? Clear?
excuse me, sir.
Ah.
Sir, excuse me. Sir, I am Ayan. Sir, this was my first lecture. So, sir, I wanted to know where will I get previous class notes so I can buckle up.
Send a mail at, you got that email address till you are MBBS, which I just showed?
No, sir, no, I didn't got it.
You joined late?
Yes, sir, this was my first lecture.
Huh?
Yeah, I'm from right from the beginning, but this was my first lecture I attended.
No problems. Send me a mail at this, I'll send you the link.
Okay, sir.
Right? All right. Sure.
Sir,
Huh?
sir, is there any other bone except first rib which join to manubrium?
Sorry. I just raise your voice. Voice is coming very low. Bolo.
Sir, is there any other bone except first rib which join to manubrium?
See, all those, what I showed is, I just showed you some of the structures. It is connected with so many other structures, right? So don't take that stress that with how many other bones it is connected. Whatever is there, right? I just showed you. Gradually we'll keep on adding the things. Right? Otherwise, say for example, vertebra. So in the vertebra, so there are so many things. Because it is connected, it has got the transverse process, it has got the entire spinous process, then there are tubercles, then those tubercles, they are connected with those muscles. Some of the muscles, they are between intervertebra, anterior supporting ligament, posterior supporting ligament. In between, there would be intervertebral disc, there will be grooves through which the nerves will be coming out. From the foramen, the entire spine will be passing. So there will be so many structures. But what I'm trying to say is we'll gradually build up, right? So don't worry about, is this the complete thing? No, right? Gradually we'll keep on building up. So it is like if we say that, okay, this is the first gear, right? So it is not the gear in which you'll be running your car at the top speed. Slowly and gradually, I'll take you to the top speed. Okay?
Excuse me, sir. So can you go to that elbow joint page once?
Question. What's the question?
So actually that page downside one's page, I didn't get that term. Like I can't pronounce it now.
Which one?
That brusa avoids friction.
Barsa.
Barsa.
Wherever you hear the word barsa, we sit like this, right? On
Yes.
table, we sit like this. There is a barsa here. Because God was knowing कि ये लोग ऐसे पढ़ने बैठेंगे, right? So when the bone will constantly hit, so unnecessary, it will be giving pressure on that ulnar nerve. So there is a bursa, fluid-filled cushion, right? We'll say fluid-filled cushion is there. There are such several bursas into the entire body. So these bursas, their function is avoid friction, to give the protection. Right? So
that is attached to bone.
That is in between. It is not attached to bone. It is in between.
Okay, between the bones.
No, so bone is there and then the soft tissue and in between the bursa.
Okay.
Right?
Sir.
So it is on the bone, so that then bone is not getting any friction. Wherever it would be like that bursa would be there.
Okay.
So if you must have noticed that sometimes कई बार ऐसे बैठे रहते तो then it starts hurting over here. Right? It hurts. Or if you're playing table tennis or if you're playing lawn tennis, so that thing what is called as the tennis elbow. These bursas, they are prone for inflammation. So that is what is called as the bursitis. Bursitis. Wherever the word itis comes, it means inflammation. Inflammation means because of the constant pressure, there got the inflammation in this bursa. And when there is inflammation, that means more fluid is there. Space is restricted. More fluid gets accumulated, it gives pain. So in such cases, rest is the only remedy. You give the rest and then that thing would subside. Pain will go away. Right? So that is the bursitis.
Okay.
Then there is acute and chronic and infected, and then there are so many things. But this is the basic principle. Right?
Okay, sir.
Can you tell the definition of sulcus? What does exactly it mean?
I told you sulcus is what? Sulcus is a groove. So on, there is one mountain on one side, second mountain on second side. There is a valley in between. So that is called as the sulcus. Sulcus is a groove. ridge, right, which is in between. And through that ridge, that bicipital, that's why we call it bicipital groove.
Okay, sir. Thank you.
All right. So see you next time.
Thank you, sir.
And
Thank
we'll be
you, sir.
discussing about
Bye,
all the
sir.
things,
Thank you, sir. Bye, sir.
physical,
Bye,
mental,
sir.
and the financial.
Thank you,
Bye-bye.
sir. Bye,
Bye,
sir.
sir. Thank you, sir.
Bye, sir. Thank you.
Bye.
Thank you,
Thank you,
sir.
sir. Bye, bye, sir.